Personnel Committee to order. Paul Koretz as chair, and Councilmember Parks are present. We're going to ask that item number 1 and 2 be continued at the request of Councilmember Zine. Item number 5 is going to be continued because the ordinance that is required to be part of that item is not quite finalized. So we'll only be hearing item 3 and 4. So if we could begin with item 3.
Item number 3, Personnel Department report relative to the execution of a 4th-year extension of the current contract with Managed Health Network to provide employee assistance program services for the city's civilian modified flexible benefits program from January 1st, 2011 through December 31st, 2011, with an option to extend the contract for a 5th year.
You'd like to start with a short report for us?
Good afternoon. My name is Alex Vasquez. I'm with the Personnel Department. What you have before you is a request to extend the contract with the Managed Health Network, which is our employee assistance program provider for the Civilian Flex Benefits Program. We're requesting that the council approve an extension of this contract as it's already beyond the 3-year contract period, and we're requesting an extension for plan year 2011, as well as an extension for plan year 2012, which will be the 5th year. This contract, what it provides is it provides at no cost, and it provides services to employees who need assistance. It has a 24/7 toll-free clinical referral line that can assist employees that are having issues with family issues, legal issues, or any type of crisis situation that they're in. It also provides services to departments that are having issues with dealing with employees or need to refer to employees for such services. The program also provides training hours for departments and employees on a variety of work-life type workshops, including stress management, change management, management and supervisory skills, any financial and legal type workshops. We do plan to issue an RFP for the following, for a new provider for plan year 2013, and we'll be issuing that RFP in November, December of this year. And if you have any questions, I'm happy to address any questions you may have.
Yeah, I definitely have a few. Just to give us a little background, could you explain the role of the city's Joint Labor Management Benefits Committee in providing this flex benefit program for active employees?
The Joint Labor Management Committee comprises of management and labor reps, and this committee was set up to basically oversee and administer the flex benefits that are provided to civilian employees. And we have approximately 26,000 employees in that program and approximately 60,000 dependents. And this provides for their health, dental, life insurance, disability insurance, as well as this program, the Employee Assistance Program.
And how does the committee actually do that as a practical matter?
The committee meets on a monthly basis, and basically Personnel Department is staffs the committee, and annually the committee reviews the upcoming contracts and the rate renewals, makes recommendations on plan design changes, and basically votes on any types of changes to the plan and the contract renewals.
Now, the contract with the Managed Healthcare Network, I guess, ended the end of the year in 2010. And the Joint Labor Management Committee recommended that it be extended at one of their 2010 meetings. When did it actually make this recommendation? Because your report states that it was their July 15th meeting, but the minutes from their meeting state that the recommendation was made in February of 2010.
Yes, actually this issue went before the committee twice, and it went in February because we asked them to, a decision had to be made as to whether or not we were going to go to RFP because it was already, in 2010, it would have been beyond the third year. It also went again to the committee in July, and we took all the contracts for renewal to the committee in July for consideration. But at that point, we knew what the rate renewal was going to be for each of these contracts, including the EAP service. So in other words, in February, we were still in a negotiation process with the provider, and then July, then we knew that we were not going to get an increase in the rates. So that's why we took the item back to the committee in July. So I apologize for the confusion. I also should point out that there was a delay in bringing this item back, bringing this item to the council for approval. Ideally, we would have brought that issue for the contract extension to this body much sooner. However, it was an unusual year. We had a mid-year open enrollment and some changes that we had to implement July 1st. So again, I apologize for not bringing this contract to this committee sooner.
So have we been on month to month since December?
Well, technically, it's not a month-to-month. With these contracts, they're similar to an MOU that they continue until there's a replacement contract. Because we started the plan year already, and these services are being provided to employees, it's not like we can stop the contract services. We continue to pay for the services until we get a replacement contract or we get an extension of this contract.
So we're not paying a higher month-to-month rate, I
No.
presume. We're paying
No.
the same rate we've been paying.
Yes.
Okay. And your written report to council doesn't actually give council any justification as to why the contract should be renewed. So why should we not go out to RFP now, and what's the justification for renewing it or extending it?
Well, one of the main justifications is that we're very satisfied with the services that the current provider is providing. We also wanted to continue with the current provider to avoid disruption of services to employees. We also, as I mentioned before, implemented some major changes to the flex plan. And every time there's changes to the flex plan, we have to explain those changes to employees. This would have added to the complexity of those changes. In addition, we also got from the provider that they agreed not to increase the rates. So we pay $1.24 per employee per month, and it's relatively one of the most cost-effective programs that we have. Compared to some of the other groups that have this service, ours is probably the least expensive.
Now, when we read the Labor Management Committee minutes, we noticed that there was a request to the vendor to take a 10% cut. Why did they not agree to that request?
I don't know that they gave us any specific answer why they didn't agree to it. We did raise that issue with the vendor at the time when we were in contract negotiations with them, but they opted not to provide the city with a reduction in the rates.
Do we typically pursue that more aggressively, or do we just make the request and accept people's refusal to do it?
Well, it depends on the situation. In this situation, we did ask for a rate reduction. We did convey that that was coming from the JLMBC, but they declined to give us a rate reduction. And again, one of the factors we took into consideration is that it is one of the, in terms of comparison with some of the other plans in the city, we do have the best rate compared to what other groups are paying.
Mr. Parks, do you have any questions?
Yes, let me just ask, did you compute at all the fact that they didn't give you a reduction of 10%, but they maintain the cost for 2 years currently? Have you figured out whether that was a savings or how much we would have been paying on this extension?
No, we haven't calculated what it would have been. They also did indicate that they were willing to keep the same rates if we extend the contract for the 4th and 5th year. So no rate increase for the 5 years.
We need to figure out what that might have been, because although they didn't cut it, the fact that they didn't increase it
Sure.
some savings for us. The other thing, if I remember, this was a 3-1-1? We did 3 years, then we have 2 one-year options?
Yes,
So this is our first option year.
yes, for 2011.
Okay, and so this gives you an opportunity not to let it won't lag on the next RFP. So the intention is going to the 5th year,
The intent is to extend it, yes, for the 5th year as well.
but in that 4.5-year mark or something, you'll put out the RFP.
Yes, we will be issuing the RFP in November or December of 2011.
And then one thing I was just wondering, do we have any idea why there's less enrollment? Is that because we've lost a number of employees? Is it a dissatisfaction? Do we know why there's a reduced number of employees using the service?
Well, we pay per employee who's in the flex plan, so it's basically actually coming from the number of people on payroll. Everybody is already automatically enrolled in the program and eligible to utilize the services. And there's been a drop in enrollment, and it's probably due to a variety of reasons, people retiring or, and departments not backfilling
So
positions.
the reduction in our overall workforce.
Right, and we pay per employee that's enrolled. So if there's a reduction in the workforce, we pay as I indicated, per person.
Thank you.
Well, if there's no other questions, I'd recommend that we approve the Personnel Department's recommendation on this item. I'll move it. Thank you. Item number 4.
Item 4, City Attorney Report and Ordinance relative to the amendment of Section 4.203 of the LA Administrative Code to authorize voluntary payroll deductions from all current and former city personnel to contribute to the Los Angeles Airport Police Athletics and Activities League.
And do we have someone here to make a staff report?
It basically speaks for itself. There's nothing controversial about it. We routinely do these. There are some that have been problematic, but this is not one of them.
Yeah, I have a couple general questions. Doesn't refer to the specifics of this recommended program. We provide this voluntary payroll deduction to current and former city personnel. Why do we include former city personnel?
You know, I don't know why we include former personnel. Traditionally and historically we have, and the controller's office is able to do that, and employees can indicate that they still want to contribute, but I don't know that there's a rationale to continue doing it or not doing it. I'd have to
We know
research
whether
that.
former employees are actually contributing to it?
I believe that they are, yes. And not just to this one, to other ones as well.
Yeah, I think people just are given a wider pool as an option. That's the way it's been historically.
And there's also a requirement that charitable organizations have working relationships with at least 15 other nonprofit charitable organizations. What's the logic behind that?
Well, we want to make sure that these are reputable organizations and that they're not just seizing, if you will, upon our employees. We have had circumstances with other organizations where their nonprofit status has lapsed. They're not in compliance, and we have unfortunately found that out in a roundabout, indirect way. So that's usually an indication that it's a legitimate organization and they're not just targeting city employees.
So I'm not sure I completely understand what the connections would be with so many charitable organizations. What do they do with each other? What are their interactions?
I don't know that they necessarily interact. The CAO's office or the controller's office might be able to answer that question better. And the person who handles these for the CAO's office is not presently here. That's Carolyn Cooper.
Well, it probably isn't a critical enough issue to delay the item, so I won't do that, but I'll ask that they report back to us just so we have some understanding of it.
Okay.
And whether it actually is a logical requirement to continue, what the thinking is behind that. I understand we want to make sure that they're a legitimate organization, but I'm not sure that requirement totally makes sense. Any other questions?
We're going to have that at council, the report back?
That's probably the easy way to do it, just
Okay.
include that in the council report. No other questions? I'd move the item. And with no objections, that'll be passed. And if there's no speakers from the public, we will be adjourned.